So you want to strengthen your pelvic floor without Kegels. Is that even possible? That's the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. People associate pelvic floor exercises as if they're synonymous to just doing Kegel exercises. And then there are Kegel exercises that we teach, but in reality, they don't necessarily involve the deeper muscles and the deeper structures related to pelvic floor dysfunction. Frankly, Kegel exercises are not necessarily for all types of pelvic floor dysfunctions either. So I'm using pelvic floor dysfunction and pelvic floor. I've done a video on the difference between the two. We're going to make sure we put it at the end of this video so you have very clear understanding of the terminology here. When it comes to strengthening the pelvic floor, we're not talking about the tissue between the anus and penis or vagina and the perineum only. We're talking about much deeper tissues. One of those tissues are piriformis muscles, they're obturator muscles, they're the external rotators of your hips. The health of your hip stabilizers play a huge role and probably the most disregarded aspect of pelvic floor therapy. The health of your sacroiliac joints, the two joints on the back of your pelvis, the lower back, the lower portion of your mid-back, these all play a huge role on the health of and strengthening of your pelvic floor area. So you may associate pelvic floor with incontinence or prolapse, either urinary or fecal, but those are only chapters of a book called Pelvic Floor Dysfunctions. So before those things happen, there are a lot of telltale signs of dysfunction that we miss. So once things are drastic, then we start looking at them differently. So the first thing to do in strengthening the area has to directly come from your breathing. Then I see videos on YouTube where the breathing it's very easy to misunderstand and actually do it incorrectly, at which point it can complicate things even more. I've done a video on how to do proper breathing. We're going to make sure we put it in the back at the end of this video for your viewing. But breathing, imagine with every breath done correctly, you're strengthening structures that directly impact and are influenced by your pelvic floor. Your movement, quality of your movement matters hugely because every little bit of dysfunction negatively impacts the pelvic floor. So just because you're doing Kegel does not mean you're addressing all different aspects of pelvic floor dysfunction. And frankly, it's so subjective as to if you're doing it even the Kegel correctly. I really like this machine called emsella that does the pelvic floor or the Kegel exercise not through a limited space but throughout the whole pelvic inlet. All of those muscles get impacted when done correctly. I hope this answered your question. If you were looking for one exercise that does the magic, there is not one, but if I had to pick one, it would be the breathing more than anything else. Because if every breath affects it positively when done right, can you imagine what it does if it's done wrong? That's always the key, right? Anyway, if you have any questions, make sure you use one of the methods of contact in the description box. If you have not subscribed to the channel, this is your opportunity to do so. If you need to make an appointment to come in to better understand what's going on with you, I'll be more than happy to help you. Thanks for watching. Take care.